Good morning, everyone. I am Dr. Kalpana Sharma, Associate Professor, Department of Zoology, S.P.C Government College, अजमेर। बच्चों, मेरे लास्ट लेक्चर में मैंने आपको हेपेटाइटिस के बारे में बताया, जिसमें मैंने बताया कि हेपेटाइटिस क्या होता है, कितने टाइप्स का होता है। आज के चैप्टर में हम लोग डायग्नोसिस के बारे में पढ़ेंगे, जिसमें हम सबसे पहले देखेंगे हिस्ट्री एंड फिजिकल एग्जाम कि डायग्नोसिस के लिए सबसे पहले क्या करते कि पेशेंट की हिस्ट्री लेते हैं और फिजिकल एग्जामिनेशन करते हैं। टू डायग्नोज हेपेटाइटिस, फर्स्ट योर डॉक्टर विल टेक योर हिस्ट्री टू डिटरमाइन एनी रिस्क फैक्टर you may have for infectious or non-infectious hepatitis. During a physical examination, your doctor may press down gently on your abdomen to see if there's pain or tenderness. Your doctor may also feel to see if your liver is enlarged. If your skin or eyes are yellow, your doctor will note this during the exam. Second is the liver function test. Liver function tests are use blood samples to determine how efficiently your liver works. Abnormal results of these tests may be the first indication that there is a problem, especially if you don't show any sign on a physical exam of liver disease. High liver enzyme levels may indicate that your liver is stressed, damaged, or not functioning properly. Other blood tests. If your liver function tests are abnormal, your doctor will likely order other blood tests to detect the source of the problem. These tests can check for the viruses that causes hepatitis. They can also be used to check for antibodies that are common in conditions like autoimmune hepatitis. Next diagnosis is the ultrasound. An abdominal ultrasound uses ultrasound waves to create an image of the organ within your abdomen. This test allows your doctor to take a close at your liver and nearby organs. What it can reveal? Fluid in your abdomen, liver damage or enlargement, liver tumors, abnormality of your gallbladder. Sometimes the pancreas shows up on ultrasound image as well. This can be useful test in determining the cause of your abnormal liver function. Fourth one is a liver biopsy. A liver biopsy is an invasive procedure that involves your doctor taking a sample of tissue from your liver. It can be done through your skin with a needle and doesn't require any surgery. An ultrasound is used to guide your doctor when taking the biopsy sample. This test allows your doctor to determine how infection or inflammation has affected your liver. It can also be used to sample any area in your liver that appear abnormal. Now, we are going to see the various types of treatments for the various types of hepatitis. First of all, we are going to see the treatment for the hepatitis A. Hepatitis A doesn't require treatment because it's short-term illness. Bed rest may be recommended if symptoms causes a great deal of discomfort. If you experience vomiting or diarrhea, follow your doctor's order for hydration and nutrition. Hepatitis A vaccine is available to prevent this infection. Most children begin vaccination between age 12 and 18 months. It's a series of 2 vaccines. Vaccination for hepatitis A is also available for adults and can be combined with the hepatitis B vaccine. Now the next is a treatment for hepatitis B. Acute hepatitis B does not require specific treatment. Chronic hepatitis B is treated with antiviral medication. This form of treatment can be costly because it must be continued for several months or years. Treatment for chronic hepatitis B also requires regular medical evaluation and monitoring to determine if the virus is responding to treatment. Hepatitis B can be prevented with vaccination. The CDC trusted source recommends hepatitis B vaccination for all newborns. The series of 3 vaccines is typically completed over the first 6 months of the childhood. The vaccine is also recommended for all healthcare and medical personnel. Now, the treatment for hepatitis C. Antiviral medications are used to treat both acute and chronic forms of hepatitis C. People who develop chronic hepatitis C are typically treated with a combination of antiviral drug therapies. There may also need further testing to determine the best form of treatment. People who develop cirrhosis or the scarring of liver or liver diseases such as a result of chronic hepatitis C may be the candidate for the liver transplant. Currently, there is no vaccination for hepatitis C. Now we are going to see the treatment for hepatitis D. There is no antiviral medication exists for the treatment of hepatitis D at this time. According to a 2013 study trusted source, a drug called alpha interferon can be used to treat hepatitis D, but it only shows improvement in about 25 to 30% of people. Hepatitis D can be prevented by getting the vaccination for hepatitis B, as infection with hepatitis B is necessary for hepatitis D to develop. Now, we are going to see the hygiene of hepatitis. First of all, we are going to see the hygiene for hepatitis A and E. क्या ध्यान रखना चाहिए hepatitis A और E में? If we are traveling to developing countries, what should we avoid? We should avoid local water, ice, raw or undercooked shellfish or oyster, raw fruits and vegetable. For hepatitis B, C and D, contracted through contaminated blood can be prevented by number 1, not sharing drug needles, 2, not sharing razors, number 3, not using someone else's toothbrush, and lastly, not touching spilled blood. Hepatitis B and C can also be contracted through sexual intercourse and intimate sexual contact. Practicing safe sex by using condoms and dental dams can help decrease the risk of infection. You can find many options available for purchase online. Vaccines. The use of vaccine is an important key to prevent hepatitis. Vaccinations are available to prevent the development of hepatitis A and B. Experts are currently developing vaccines against hepatitis C. A vaccination for hepatitis E exists in China, but it isn't available in the United States. In the next slide, we are going to see the complication of hepatitis. Chronic hepatitis B or C can often lead to more serious health problems because the virus affects the liver. People with chronic hepatitis B or C are at risk for chronic liver disease, cirrhosis, and liver cancer. When your liver stops functioning normally, liver failure can occur. Complications of liver failure include bleeding disorders, a buildup of fluid in your abdomen known as ascites, increased blood pressure in portal veins that enter your liver known as portal hypertension. Number 3, kidney failure. Number 4, hepatic encephalopathy, which can involve fatigue, memory loss, and diminished mental abilities due to the buildup of toxins like ammonia that affects brain function. And lastly, the hepatocellular carcinoma, which is a form of liver cancer. In complications, the death can also occur. People with chronic hepatitis B and C are encouraged to avoid alcohol because it can accelerate liver diseases and failure. Certain supplements and medications can also affect liver function. If you have chronic B or C hepatitis, check your doctor before taking any medication. Thank you.